Eosinophilic esophagitis is an increasingly diagnosed chronic inflammatory disease of the esophagus, causing symptoms of dysphagia and food impaction. Endoscopically, concentric rings, linear furrows, white exudates, edema, strictures, diffuse narrowing, and crepe paper appearance can be identified, although in some patients none of these signs are present. Endoscopic signs of eosinophilic esophagitis are not pathognomic for eosinophilic esophagitis and are scored with variable reliability. Therefore, the diagnosis of eosinophilic esophagitis cannot be based solely on endoscopic signs and requires esophageal biopsy sampling. Recently, a validated classification system for the endoscopic assessment of esophageal signs of eosinophilic esophagitis, ER/EFs, have been introduced, showing good interobservant agreement for most signs. The ER/EFs enable uniform scoring of endoscopic signs. It has not yet been evaluated by other investigators and the interobserver agreement has not been assessed. The value of the ER/EFs is thus not completely known. If the good interobserver agreement could be confirmed, and if intra-observer agreement also appears to be good, this would endorse application of the classification system in clinical trials and the follow-up of patients in eosinophilic esophagitis. The aim of the current study, therefore, was to further validate the classification system by assessing interobserver and intra-observer agreement of endoscopic signs in patients with eosinophilic esophagitis, both in active disease and in remission. Background and study aims. Recently, the Endoscopic Reference Score, ER/EFs, for endoscopic assessment of eosinophilic esophagitis was introduced, with good intra-observer agreement for most signs. The ER/EFs have not yet been evaluated by other investigators, and intra-observer agreement has not been assessed. The aim of this study was to further validate the ER/EFs by assessing interobserver and intra-observer agreement of endoscopic signs in patients with eosinophilic esophagitis. Patients and methods. High-quality endoscopic images were made of the esophagus of 30 patients with eosinophilic esophagitis, age 36 years, range 23 to 46 years, 5 female, 6 of whom were in remission. At least 3 depersonalized images per patient were incorporated into a slideshow. Images were scored by 4 expert and 4 trainee endoscopists who were blinded to the patient's conditions. Interobserver agreement was assessed. After 4 weeks, the images were rescored in a different order to assess interobserver agreement. Results. Interobserver agreement was substantial for rings, white exudates, and crepe paper esophagus, moderate for furrows and strictures, and slight for edema. Intra-observer agreement was substantial for rings, furrows, and crepe paper esophagus, moderate for white exudates, and strictures and less than chance for edema. Inter- and intra-observer agreement was not substantially different between expert and trainee endoscopists. Conclusions. Using the ER/EFs, endoscopic signs of eosinophilic esophagitis were scored consistently by expert and trainee endoscopists.